Hi, welcome to week 7 of your Medical Language 2 course. We're going to be covering 2 chapters this week. The first chapter we're going to cover is a pharmacy law, and that's basically what I'm going to focus on this presentation because this is a really important chapter for you to understand. You're going to see questions about the law when you take your PTCB exam, so make sure you're familiar with these laws. I mean, you're not going to have to know them like, word for word or anything like that, but you kind of need to just know the gist of most of them. And so if somebody says, well, what was this law about? You know what it was about. So when you think back about, you could be just even 100 years or so ago, a lot of things were being marketed or sold as cure-alls. So in other words, it might say it's going to cure your, liver ailments and hair loss and all of these things might have been listed on the bottle. So that's where it kind of started. That's where some of these laws kind of began. So what they did was, over the years, the federal government has updated and changed laws to address some of the problems that they saw. One of the first laws you'll read about is the Pure Food and Drug Act of 1906. Basically, what this said was you couldn't sell something that was misbranded. In other words, you couldn't say that it cured everything if it really didn't do that. So it kind of kept folks from being able to, sell things that could easily harm someone. A lot of times, most of the drugs back then, they basically just contained alcohol. They didn't do much of anything else. So this kept them from, containing things like arsenic even. That was included in a lot of medications back then. So again, it was more for the safety of the population than anything else. So that's kind of where we started with our laws back then. And then we moved on. The next one that you'll read about is the Harrison Narcotics Tax Act of 1914. And this one had to do with opiates. So anything containing opium or cocaine, that's what this particular law was all about. Then we had the Food, Drug, and Cosmetic Act of 1938. And this one is where we started getting into having the FDA going through the approval process. So that's where the approval process started. So this is where manufacturers had to start looking at not only, is it safe, but they had to look at their packaging, the strength, food and drug, cosmetics, all were kind of thrown into this now. So that's where that change came from. Then we have the Durham-Humphrey Amendment. So this one said that, there's things that would have to have a certain label, and it has to say prescription only. So that's where that RX comes from. So that's where that started. The Kiefer-Harris Amendment, again, all about purity. So this is another one about purity, that's where this one came from. The Comprehensive Drug Abuse Prevention and Control Act of 1970, this is where we started getting into the whole idea of controlled substances. So this is where we put together those categories. So where you're talking about the different classifications. So now if folks are doing things against us, now they're totally being prosecuted under the Controlled Substance Act. Another thing that was created around the same time was the Poison Prevention Act. And this was where we had to put safety caps on things so that young children couldn't get a hold of them. The Drug Listing Act of 1972 is what established our NDC codes. We have the Orphan Drug Act, which is really important. Orphan drugs are those drugs that are used to treat conditions that not too many people have. And typically what happens is, if you're working for a company and you're in R&D, research and development, companies don't want to put a whole lot of money into researching a particular condition if not a lot of folks have it, because ultimately they're not going to necessarily make their money back on that research. So what this particular act did was it offered an incentive. So it gave these drug companies a financial incentive to actually go in and do the research for those particular diseases that not a lot of people might be afflicted with. We have the Omnibus Reconciliation Act, which is OBRA. So that's where you'll see where we talk about Medicaid, Medicare. We have, lots of things having to do with Americans with Disabilities Act. Of course, we have HIPAA, which you're going to read about in this particular chapter. And then the combat methamphetamine epidemic is another one that is a really big one. This is where they have, this is where the regulations for Sudafed come from. And then, of course, there's lots of state regulations, state laws that are going to be in effect. Typically, the idea is whoever's the most strict is the one we have to follow. So it's kind of like, going and asking mom, going and asking dad. Whoever's the meanest is the one you have to listen to. So that's kind of how the state and the federal laws work. So whichever is the strictest law, that's the one that we're required to follow. So that's the kind of things you're going to read about in chapter 25. In chapter 26, the other chapter you're going to read this week, this one's all about pharmacy operations. So you're going to look at things like budgeting, how to handle inventory and record keeping, all of those types of topics. So if you have any questions as you go through this week's material, please make sure you reach out to me. You can email, call, or text anytime, and have a great week.